So I work for Mackey Family Practice in Lancaster, South Carolina. It's a primary care practice, privately owned. We're a certified patient-centered medical home, which basically means that everything is patient-centered. Everything we do is about the patient. We track looking at population health outcomes, trying to make sure that we improve lab values, we improve clinical outcomes to try to help control patients' chronic diseases. I came into that position through a Kennedy Center pilot program. Being able to work this closely with the medical team, I work side by side with the doctors and the nurses every day as we take care of our patients. It really has allowed me to practice to the top of my license, to use all of the education that I spent so long working for, and the Kennedy Center really made that possible. It really gives you a good sense of satisfaction when you see a patient come back and they understand what you've taught them, and they really are appreciative that you've spent the time to sit down with them and explain their medications and explain their disease state. And it really, it's very fulfilling to be able to see those responses come back. So the programs that the Kennedy Center has worked to implement in this practice model that I work under is completely unique. It's not something that we see in a whole lot of practices across the country. So it's been really a neat experience to be involved in that. It's groundbreaking. The Kennedy Center has really done a lot of research. They've pushed for payment reform to be able to make this a sustainable practice model. They've really supported me in that position as far as with research and with any sort of help that I needed. The Kennedy Center has so much to offer as far as non-traditional practice models. It's definitely something that if you have the opportunity, you need to take advantage of. This is not a position I ever would have seen myself in, but now that that's what I'm doing, I can't imagine doing anything else.